Do you have chronic medical problems and you just cannot shake them off? Have you been to multiple specialists? They've done a lot of blood tests and other testing, diagnostic testing, and they just cannot get to the bottom of your problem? Well, maybe they're just not looking at the root causes of your problems. And one of the ways how we can start figuring out is actually to look at your metabolism of your cells. Really look at the machinery in the cells, how that works, and then from that we can deduce what may be causing the problem. So today we'll walk through one of the tests that can be done at home. It is based on collection of the urine and also a finger stick that can be done safely at your home in collecting data and sending that to the company that will run this test. And then it will give us a vast amount of information, and let's walk through that test, and I will give you the benefits of this test and I explain you how I interpret that and what I'm looking for when I'm interpreting this test. So you'll be kind of following this with me on the screen. First page, typically company, and it's done through artificial intelligence or AI. This report is generated and gives us numerical values. It's not necessarily massively accurate, but at the same time it gives us some idea what we really need to pay attention to. For example, in this particular sample case, omega balances are significantly impaired. You can see that 8 to 10 is considered to be significantly impaired, and 7th are kind of require also support. So let's look through the data and kind of figure out what's going on there. But before we'll go there, I want to explain that this test really revolves around mitochondrial function. Everything in our life relates to energy produced for our body. When our mitochondria does not function, we are not able to function. For example, brain consumes about 21% of all the energy that's produced in every cell in the body. At the same time, it's only about 3% of the body weight. So your heart consumes about 15% of the energy. So a lot of organs consume a lot of energy, and if that energy is lacking, then all of a sudden we will have problems in those organs. So the first box in this test is called malabsorption and dysbiosis markers, and it looks at metabolic activity of our bacteria in our gut. It does not look specifically at that bacteria. There are other tests that are much more valuable for that. But it tells us if you have too much metabolic activity, and high metabolic activity typically is linked to more pathological bacteria or abnormal bacteria. So we want that activity to be as normal as possible. And based on individual situation, based on a history that a patient tells me, I will decide whether we need to go further and look at this stool tests so we can actually explore the bacteria in the gut, or we need to look at other tests to figure out what else may be going on with the gut. Then we will look at the fatty acid metabolism. After we consume our fats, after we absorb our fats in our gut, those fats has to go for processing in our liver. And if our liver is lacking certain substances, it cannot process them adequately, and it will eventually develop fatty liver disease. That is, unfortunately, is notorious right now in our society. Also, we'll be looking at your carbohydrate metabolism. This is a very important part of this test because based on this data, I can deduce how many calories does the patient need to take, what kind of macros he or she should be taking, fats, how many proteins, how many carbohydrates, how many times a day that person needs to be eating for optimal metabolism. This is not based on some dogma, it is not based on some kind of blog, but it's really based on individual biochemistry of that particular patient. Then we will be looking at energy metabolism. So these are the same values as you can see on this schematic on the Krebs cycle. So we actually are able to measure all the Krebs cycle metabolites and figure out whether all of this chain reaction is running appropriately or optimally. And if it's not, the rest of the test is really designed to help us to figure out why that happens. So we'll be able to see whether B vitamins that you consume, all the B1s, B2, B3s, are working appropriately in your cells. Are they getting into your cells? We can have good levels in the blood, but they may not be getting into cells and may not be doing what they're supposed to do. Then we'll look at the methylation markers, which are vitamin B2, vitamin B12 and folate. Then we'll look at the biotin markers. Then we will look at multiple reactions that are controlled by vitamin B6 because it's profoundly important for our brain function. Then we'll actually able to look at the catecholamine markers like dopamine, epinephrine, norepinephrine, and see if there are any deficiencies there, and do we need to look at that even further. The biggest thing we will be looking at would be toxins and detoxification markers. Toxins will reduce efficiency of our Krebs cycle or our mitochondrial cycle. So we want to make sure that toxins will not be affecting. We all are exposed to toxins, but some of us are able to remove them appropriately, and some of them are accumulating them, and then that causes a lot of issues. Also, these tests allow us to look at the oxalate markers. There are a lot of patients with oxalate kidney stones. Certainly, it's a very unpleasant condition. So we want to make sure that they have appropriate biochemistry, or based on that, we can recommend an oxalate, decreased oxalate or oxalate-free diet, kind of depending on the values. The other thing we'll be looking at is oxidative damage. All the lipids that are surrounding our cells, basically fatty membranes or cell membranes, can get damaged or oxidized because of the other conditions. And if they are, those cells will not function properly, and sometimes they will either quit working, or sometimes they will develop into cancers. So we want to make sure that oxidative damage is not present or controlled. Then we also will be able to look at amino acids. We're looking at amino acids in our urine. So if amino acids are very low, then that means that typically our body is holding on to proteins and does not want to release it. Sometimes it also means that the proteins in the blood are very low, and we may need to look at it a little bit further. We also would be able to look at the omega-3s and omega-6s. Remember, omega-3s are anti-inflammatory and omega-6s are pro-inflammatory. There is always should be a balance. We absolutely do not want to be with just omega-3s and no omega-6s, because that actually will not allow our body to function properly, but we want to have a ratio, and we'll be looking for specific ratio in those patients. We also will be able to see omega-9s, omega monounsaturated fats. We'll be able to see the saturated fats. So there's a lot of information in this test that tells us what kind of fats the person should be consuming to optimize their lipid status. Then we also are able to deduce how are they processing those omega-6s. Because sometimes multiple deficiencies in vitamins, and you can see that a lot of vitamins are involved here, will not allow us to process all the omega-6s correctly. For example, arachidonic acid is profoundly important for our immune system. So if we have problems with arachidonic acid, then our immune system will not function properly. And then the biggest thing also in this test also tells us about elemental markers. Not only the regular markers that we want to see, calcium, magnesium, potassium, sulfur, but also the toxic markers that potentially can affect, again, our mitochondria. And that includes lead and mercury, but also aluminum. And unfortunately, there is a lot of aluminum in our nature. We use the cooking utensils, we use a lot of aluminum-based deodorants. So if it's too high, then it potentially can cause problems. High aluminum also has been linked to Alzheimer's, so we certainly don't want that. Arsenic, barium, bismuth, so gadolinium. So if patients, for example, had a lot of gadolinium-enhanced MRIs, we would like to know what the levels are and whether they're able to remove it appropriately. So again, a lot of toxins that we can see, even uranium. So in some areas, there is so much uranium in the water that they actually will have a higher level of uranium in their urine. So we want to really know about that. So this is, as you can see, this is a very comprehensive test. It's certainly not a test that will solve all the problems, but it's a great start to really point us to direction where we need to go next and how can we really focus on getting the figuring out the root cause of the problems. If that makes sense, consider getting an appointment with me. I'll be happy to talk to you about your issues, or you can actually get this test and really will be able to review this test for you. And then I'll be able to guide you on, again, whether you want to work with me or not, what to do next.